This special program is sponsored by Regence Blue Cross Blue Shield of Oregon and Sequoia Mental Health Services.
Isolation in the pandemic really drew back the curtain on a lot of those stresses.
And the numbers are startling and concerning. From the most recent CDC data, in 2021, more than 4 in 10 students felt persistently sad or hopeless. More than 1 in 5 students seriously considered attempting suicide, and 1 in 10 tried to kill themselves. Adolescent mental health continues to worsen after the pandemic.
I think there's just like new pressures put on us as teenagers that didn't exist years ago.
Yeah, we are seeing more anxiety, more depression.
The CDC says poor mental health in adolescence can impact many areas of a teen's life. It often goes hand in hand with other health and behavioral risks, like drug use, experiencing violence, and higher risk sexual behaviors. Tonight, we have a panel of experts, young people and parents who have been there. You may remember Angie Welty and her son Cody from a past town hall. He's a suicide survivor after trying to take his own life at 17. They know the importance of bringing problems like these out in the open.
You can have these conversations and be okay.
None of this is easy for kids or even adults to deal with.
We'll talk about the problem in this post-pandemic era and what you can do at home right now to help your child through these difficult times. Our Recover Northwest Town Hall, Youth Mental Health, the Pandemic's Toll, starts right now. And good evening, everybody, and thank you for joining us for this special Katu Town Hall on youth mental health following the pandemic. I'm Steve Dunn.
And I'm Deborah Knapp. While it may feel like the pandemic is coming to an end, this is our first totally in-person town hall since it began. The lasting effects are still really all around us. Over the next hour, we'll hear from experts, teens, and parents about the impact the last 3 years have had on youth all across Oregon.
Let's begin with our panel of experts tonight. Joining us are Dr. Mike Franz, the Senior Medical Director of Behavioral Health at Regence, Ebony Clarke, the Behavioral Health Director for the Oregon Health Authority, Dr. Craigan Usher, Director of Child and Adolescent Psychiatry Training at OHSU, and a practicing child and adolescent psychiatrist. Also, Marcia Healy, Executive Director of Sequoia Mental Health Services.
Also joining us are parents and teenagers from across the metro area. To find people who wanted to participate, we contacted several youth organizations and more than 24 school districts across the state. Tonight, they will share their stories and struggles as we look at ways to deal with what the pandemic has left in its wake.
Let's start our program right now. I want to do this by, first of all, show of hands for our youth here. How many of you in the audience felt your mental health decline due to the pandemic? I want to see a show of hands. So it's a whole lot of them, and we're going to get some answers for you tonight, I promise. We're going to begin with you. Will you give me your name, please?
Yeah, Rosuhana Hafiz.
Rosuhana, and I saw earlier you were telling us that you really were affected by the pandemic. Tell me how.
Yeah, so during the pandemic, I was very isolated. I felt like I wasn't connected with my peers, including my family. I just felt like I was in my room the whole time on Zoom calls, and it just didn't feel like myself at all.
What did that do to you mentally and emotionally? Tell me about that.
Yeah, so it definitely affected my mental health as I wasn't talking with anyone at that time. I was just alone, and I felt like I just didn't feel like myself, I want to say that. And especially since having school online where I wasn't able to connect with any of my teachers, it felt terrible.
I know you have lots of stories to tell here tonight. I know, Deb, you've got someone else over here as well.
Connection's a big part of the issue that we're dealing with here. I want to talk to Lane. And Lane, from what I know of you, you're 18, a senior, so you're a freshman when this all started. Let's talk about your activities. You're an athlete in wrestling. So how did this impact your community?
Yeah, so for me, wrestling has always been an escape. It's somewhere where I feel safe and am able to get out a lot of my stress and have a community there. And when COVID began, wrestling was one of the first things to go, and it was one of the last things to come back because of how contact heavy it is. And so for me, losing that, that physical outlet for my emotions, for my stress, for my anxiety was really hard. And it was also hard to lose that community of people who I was used to seeing on an almost daily basis.
I mean, being a teenager is really a social time of life, and all of a sudden you're in your room by yourself doing Zoom school. How did that impact your friendships?
I would say it impacted my friendships by worsening them because I think everybody can say the same. It's really hard to maintain a friendship when it's purely online. And especially when you're locked up in your room, it's really easy to become closed off and kind of close yourself into a bubble. And I don't think that was unique to athletes. I think that was a common experience.
And this has really been the first full year back to school. So how has that been integrating back in the classroom?
I think integrating back into the classroom, into athletics, into every aspect of life has been a really incredible experience, and it rejuvenated a lot of people's mental health. It made people more excited to be at school and to be learning, and it helped me build a lot of those friendships back.
Lane, thank you.
Dr. Franz, I want to bring you in on this now. And we hear these stories. We're going to be hearing more tonight, obviously. This is all across the country that these youth have gone through this pandemic, and they're suffering because of it. Is that what you're seeing at Regence right now? I'm going to come on this side so you can get a better shot of you.
It is. It's certainly not unique just to Oregon. It's a national experience, but it's actually statistically looks worse in Oregon. And I think the examples that we've heard today are exemplary of what a lot of young kids, young adults have experienced across the country. The issues with behavioral health, the emergency that was declared by the American Academy of Pediatrics and the American Academy of Child Adolescent Psychiatry and the Surgeon General came out of the pandemic, and we have an epidemic on top of it now with behavioral health. But we were seeing struggles with youth mental health about a decade prior to the initiation of the pandemic, and this has just exacerbated the problem.
Ebony, I want to bring you in as well, and let's talk about this a little bit, because you talked about the fact that these kids really have been affected socially and emotionally, particularly at an age when they're 10 and 12 and they need that socialization, right?
Yes. No, I would just say that oftentimes we forget how important connection is as human beings. And in the pandemic, you know, youth were kind of left on their own, having to grapple with depression, anxiety, trauma. You know, I've heard stories of youth and young adults experiencing fear and confusion because as they look to their parents, you know, seeing that their parents or that trusted adult in their life didn't even have the answers. And so it wreaked havoc, and we're only scratching the surface of the impact.
You know, I want to talk about the connection, and really kids were left with social media. Social media we know is not going to go anywhere, but it really tended to elevate a lot during the pandemic. Is there anybody that'd like to talk about the impact of social media during the pandemic on their life? Yeah, I'll come over here, Leanna. Okay, tell us, how did that impact you?
Yeah, so I would say in the beginning of the pandemic, there were a lot of trends going around of everybody trying to interact with each other. At the beginning, I would say it was really fun to connect in so many different ways. But towards the end of 2020, we started, I also was a freshman at the time, and I wanted to have those real social interactions in person. I remember trying to connect with friends from across the country, so that was really cool, but really I couldn't connect with these people at all, even my friends that were across the street.
Right. I see you nodding your head a lot. Was there a danger at all, do you think, with the social media access during the pandemic?
Totally. I feel like having so much access to social media, although it can be so beneficial, on the other hand, it can be so negative because there's just this constant stimulation and constant exposure to so much content. And especially when you're in your room all day, you're not even paying attention to class. This constant stimulation and exposure to all this information can like just alter your brain and the neuroplasticity. And I'm sure there's studies to support that. And I mean, the impact is profound. I'm not even sure exactly what it would be, but it's definitely not good.
Yeah, you made a good point, though. I think during the pandemic, you were really in your room by yourself on social media for a lot of these kids. And Quinn, tell me about your social media experiences during the pandemic.
Yeah, well, the only way of connection really with everyone, like friends and other family members outside of the house, was through social media. So I feel like before the pandemic, there was already kind of an obsession with social media, and I feel like all the pandemic did was like heighten that addiction for kids. And I think that it has a lasting effect even as we're still going, as it like just kids are addicted to it. And I think all it did during the pandemic was show, obviously social media is a way to see what everyone else is doing, and I think it set like unrealistic standards of how everyone should be living their life, because people would post, for example, on TikToks, like day in my life is something that's like really popular, where people will show clips of what they do each day. And so I think those videos can show like a fake version of the best aspects of everyone's day, and then that gives a false reality that everyone's like, oh, well, my life doesn't look that perfect, I must be doing something wrong, I'm behind everyone else, when in reality it's just not real, and it'll have people will create like false or fake goals that are unachievable for them.
What should change when it comes to social media then? And maybe the parents can answer this, the experts can answer, the kids can as well, but should there be restrictions on social media where it locks up at 8 o'clock at night, or what should happen in that regard? I want to come back to you, but Deb, I know you have an expert who wants to talk about it.
Yes, we're going to talk to Dr. Usher about this, because I can imagine it increases the anxiety level as well with kids. That's exactly what you were talking about, the expectations, and my life isn't matching that person's life, and it's all, you know, a facade, really.
Yeah, and it's really programmed to keep you on there as long as you can stay, as long as they can keep you, and ultimately then sell products. It's literally wired to do that to your wiring, all of our wiring, adults included. So and I will say, it also is, I like the fact that you talked about stimulation. It's stimulating, it's also simulated. It reminds me of the concept of embodied cognition. Our very metaphors that we use for connecting with people, that means like literally connecting, or hey, let's touch base. And I know, I bet many of you don't use that term, but anyway, but for us old people, like, yeah, we tell, oh, let's touch base. Like, that used to mean actually physically hug or shake hands or bump shoulders with. And when we tried to replace that with online life, what I found, a lot of the youth that I was working with, they started experiencing things that people who had very serious mental illness were experiencing: dissociation, derealization. They felt like, I'm living in a cloud above my head, and I don't know how to get back to physical reality.
We're going to continue our discussion here about social media and youth mental health. What can we do about all this? And I want to hear from some of the parents too when we come back on the program, so stay with us. Welcome back to our town hall program, Youth Mental Health, a post-pandemic. Before we went to the break, we were talking about social media and its impact on youth, and particularly during and after the pandemic. And we happen to have a mother-son here, so we're going to get a good perspective on social media and what it's done and what we can do about it. You're Noah.
Yes.
Tell me about social media, its impact on you.
Yeah, I've definitely found myself relying much more on social media lately for friendships, as well as just social interactions altogether, really. I find myself waiting for likes on Instagram or waiting for a message on Snapchat to return. And a lot of my friends just don't talk in person anymore. They talk more in text form on social media. And I just find it really sad that we can't connect anymore in person.
And do you think the pandemic exacerbated that problem?
Oh, definitely. I found myself hanging out with friends less and less over the pandemic. Even friends I have right down the road from me. And even friends I knew for a while, they just disappeared after a while.
Yeah, well, Lisa, you watched all this unfold, of course, in your household. First of all, I want to ask you the question. As you watch this and you think as a parent, boy, did you have questions about what can I do about this? How can I control it?
I think that's been my husband and I's question since day one. As we've noticed, the youth have been told this is your new normal. You're just going to have to forge ahead, get used to it, make do, and go on. It happened, and this is what's going on. And I don't want that to be their new normal. I know they lost 2 very crucial years of their life where they should have been developing social skills, interacting, identifying, and figuring things out. They lost that. So my question is to the youth, what can we do as the adults in your life? What can we do to give a little piece of that back? We can't bring back 2 years of your life, but what can we do to make things either, whether it be through social media? What do you need from us? Because I think that's what we're missing. What do they need from us? We're the adults. What can we give back?
Any of the youth here want to answer that question she has? What can they do to help you out to get those 2 years back? And maybe that's a better question for an expert.
Probably for an expert. Let's find out some key elements of how we can help the kids, the youth, right now when it comes to this real addiction to getting...
Well, I apologize for interrupting you, but
No.
I actually am really excited about hearing what the youth have to say about this. I will offer, I think one of the things we can do is be a great example, putting it down ourselves. It was hard before I walked to my seat, turning my phone off and leaving it over there. And I know it's in the same room as me right now. So my brain is actually thinking about the presence of my phone, what it is that I'm missing. So even in this moment, having it outside the room can make a big difference. So that's one tip I'm going to offer. Adults, do this first before you expect your kids to start having the phone outside the room. Neuroscience suggests if it's outside the room, it is more out of mind.
Could it be something like at nighttime? Because so much sleep is lost, right? If you're at home in bed, can't sleep, you're scrolling. So could it be something as simple as turning it in at a certain time?
Yep, there are devices that you can use to lock it away from yourself for a few hours. I've recommended that to a number of youth who have found it useful. And a lot of people find this really difficult. Again, I emphasize that adults should try this first before they're going to ask their kids to do this.
I would agree with that.
Yeah.
Absolutely. I know a lot of, I know you do too, Deb.
Yes.
A lot of adults who just can't put that phone down, but we're asking our kids to do this, and they're watching us, right? Brandon, let's talk about your situation with social media.
For me, social media I don't really use the messaging option that much, but in general, a lot of social medias are both messaging and content, and the content algorithms are just downright predatory sometimes. Like, especially in the pandemic where time seemed to just kind of blur together, you could get lost for hours on end, and that's all time that you're losing that you could have been doing something actually productive, you know, kind of venturing, finding things about yourself, finding things about your friends, making connections. All that time was lost, and it's just because you get sucked in way too easily.
I want to shift gears just a little bit and talk about academics, because obviously that's a big part of all this. Some of you were in 7th grade when the pandemic began. Next thing you know, you were in 10th grade and had to deal with that. And I want to step right up here because I know you wanted to talk about this.
I have definitely seen at my school that the people around me, as someone else was saying, like, they don't connect with each other at all. And you're walking through the hallway to your next class and all you see is like the tops of people's heads because they're just on their phones the whole time. And we'll have a break in class and people will just pull out their cell phones. They're unable to put them away during class, and it's all because of the phones.
Right. And academically, though, have you been affected by that because of the pandemic and you were out of the classroom for so long?
Yes, I definitely, over the pandemic, it was very hard to be learning and not being able to contact your teachers or just raise your hand and ask a question, because we didn't have Zoom meetings. It was just, here's the work and you get it done. And it was very hard to stay engaged when there wasn't an adult presence to help you. And even having your peers in the room doing their work with you helps a lot, and you just don't have the motivation to do your work.
I want to talk about, again, that this is the first year fully back to school. And Livia, I'm going to talk to you about this. The academic angle of it. Are there expectations of you as a student and where you feel like you should be and maybe where your teachers feel like you should be, but you've lost a few years there in classroom?
Yeah, so I entered my freshman year just as the pandemic was kind of finally opening up. I'm a junior now, and it's just been really difficult since my freshman year to build up like just simple like study habits and kind of the work ethic that I had been taught for so long in school that was entirely lost my freshman year due to the fact that it was entirely online. And we did have Zoom classes, and so it was just like a 6-hour day of staring at a little iPad screen in my room, and I have pretty bad ADHD, and so there's distractions everywhere. I have my phone in my lap, my dogs are downstairs. It was really difficult for me to really retain any of the information I was learning, and a lot of the core classes you take freshman year are just building through high school, and it's just been difficult now. Like as a junior that I'm taking classes that are supposed to be building on all these things I learned as a freshman, not just like concepts, but also just like study skills and habits that I don't have, and constantly being reminded by teachers who are used to teaching students. They're at a certain point, whereas a lot of people in my grade, and me in particular, are not quite there just because we lost a year of academics, or at least they weren't to the level that they typically are.
What kind of support do you feel like you need from your teachers or from your school or from your parents and people around you?
I just think we need to kind of go back to the basics and teach. Like, we had finals for the first time at the end of my sophomore year last year, and I remember sitting in my room and thinking, like, I don't even know how to study anymore. Like, I don't know the last time I studied for a test, whereas that was second nature at some point for me. And just kind of going back and giving students the resources to not only like understand the material, but actually be able to retain it and learn it themselves to where they can apply it through later classes and other subjects, rather than just like pass a test and move on from it.
Thank you.
Ebony, I want to talk to you now about this, because the underserved community certainly greatly affected by the pandemic, and there are a lot of folks, I know you saw a rise in the number of kids failing and dropping out of school, right?
Yes, yeah. So what I'll say in terms of that is that before the pandemic, we saw those disparities, and the pandemic only exacerbated those poor outcomes in terms of seeing disparate outcomes in terms of Black and brown children and youth not academically performing, dropping out of school, and then also just issues with increased general mental health issues. And, you know, I think it's important for us also to bring into the room that we saw issues of increased social, or I should say emotional, sexual, and physical abuse. And schools are often the safety net for a lot of young people. And so throughout the pandemic, students and youth didn't have that safety net where they could go and connect with a trusted adult at school, or they didn't have that opportunity to go to school and see someone say, something's going on, how can I help you? And that's something important for us to bring forward into the room tonight.
And you saw that emphasized in communities of color,
yes,
correct?
Absolutely.
And particularly during the pandemic and post-pandemic?
Yes, particularly. And I would just say, as a result, we saw increased issues of substance use. We saw increased issues of interpersonal violence. We saw increased issues of group violence and gun violence.
How is the state responding to this? Are you hearing anything as far as that goes?
Yes, well, in terms of the state, you know, we really try to work from an equity lens, both understanding the connection in terms of racial equity. And so what that means is that we're committed to looking at what the data tells us. And the data has been telling us before the pandemic that we're having this disparate outcomes on communities of color. And so we've been committed to prioritizing our policy and resource to also bolster the continuum of care, to really begin to assure that we have culturally specific and culturally responsive services throughout the mental health continuum that really can draw a young person in and help them feel accepted, welcome, so that then they can begin to open up and get the support that they need.
This is an important conversation. We're going to continue to try to find solutions. We'll be right back with more after this.
Welcome back to our town hall, Youth Mental Health Post-Pandemic. And during the break, the kids were telling us they want to talk more about academics, the impact pandemic has had on that. So we're going to begin with that.
We are. Annie has some things to say about how things really were affecting you during that time.
Yeah, so the pandemic hit for me when I was in 7th grade. And so that's the end of my middle school years. And just through the Zoom classes at home, it was so easy to be so disconnected from school and to just not have any motivation to engage in what was going on, because you could just, it was just the next test, I just need to pass this and then I'll be okay. And it was easy to find ways to collaborate with students on tests because you were at your house, you were on Zoom classes, you didn't even have to put your camera on. And this has created like a habit for me and for so many students that I've seen around me that just the motivation has been lost in school, and through my classes today, it's just hard to find that motivation to do the work. And we have to go in person, we have to be present every day, but at the same time, all of this is accessible online, and we're having, because Zoom school taught us how to do that.
You have new skills. You have new skills.
Exactly, yes. But the motivation to even go in person to school is less, and attendance has gone down because of that, because everything's accessible online. So just the motivation to be present and to be present in the studying is...
It feels like the priority
huge.
is not there as much to
Exactly.
be in person. Johnny, I want to talk to you a little bit about how things changed for you. What kind of student were you before the pandemic hit, and then once you had to go online school?
So before the pandemic, when I was in 8th grade, because that's when it happened, I would be at my grandma's house after school, walking from school to my grandma's, and I'd be sitting at the dinner table, and I would work on any assignment I had on the day until I had it finished. And I would do that on the daily until COVID hit, had to be sent back home, and then when it came to online school, I don't even remember a single day. I only remember one instance where I had crawled out of bed, I went on my laptop, I was late to a class, but I was marked attended because I was there, and the teacher sounded very disappointed because this is happening on the daily for all sorts of students at that school.
And how is it now that you're back in school?
Now that I'm back in school, I dog on my friends all the time for this, but I always see my mate next to me. He's on his phone in the middle of class. Then he'll freak out because he missed something in the lecture, and then he goes back, write a note, and then pulls out his phone 10 minutes later.
So it's the whole habits have changed.
They certainly have. And Dr. Franz, I want to bring you in on this now, because what do we do to get these kids re-engaged in school if they've been out for so long and been dealing with this pandemic from home?
Well, I think we still need to address maybe some of their underlying mental health issues that are still probably impacted. I mean, the statistics are clear that a lot of the kids are still struggling with depression and anxiety, and I think making sure they get access so that they can address their mental health and feel more motivated and able to attend school, comfortable, decrease that anxiety of going back into the classroom, increase the motivation and help them develop the skills that they need to re-engage in their academics. So that comes down to providing them access to timely, quality behavioral health resources, and that's the solutions that we're working on at Regence.
And there's some barriers to that treatment right now, aren't there?
Absolutely. There's a tremendous workforce shortage. Everyone in this room, probably everyone watching, is very aware of that. It's not insurmountable, and some of the solutions that we've been working on is actually building up our brick and mortar providers. We've added several hundred over the past year alone in Oregon, but taking a virtual forward approach, and a lot of the workforce has actually gravitated to regional and national virtual providers who can actually, it's kind of ironic, but come into the home if needed virtually, but provide fidelity service, behavioral services such as cognitive behavioral treatment, exposure and response prevention for OCD, effective eating disorders that obviates the need, maybe even for going to residential treatment, so that you can stay in the home, stay in your school, be in your community, and get effective family-based treatment.
You just touched on something that I actually want to come over and talk to Lane about, because you mentioned to me in the break that you wanted to talk about that, and that was the eating disorders and other issues that have arisen during the pandemic.
Yeah, I think all forms of mental health issues intensified over the course of the pandemic, but I think eating disorders are something that I felt very personally intensified over the course of the pandemic, and I know it did for a lot of people, because not only are you removed from most of your athletic activities, which are often an outlet for people and allow them to get exercise and, you know, kind of avoid getting to a point where you're just sitting there eating all day, but you're also stuck in your home dealing with those mental health issues, and for a lot of people a coping mechanism is eating, and so I think for people from all walks of life, that was something that they struggled with, was, you know, sitting at your Zoom meeting eating all day, and then either developing body dysmorphia or just also from that social media aspect of things. You're sitting there on social media all day seeing these idealized body types, often edited or in the perfect pose, and you're sitting at home unable to go to your athletics, and it creates a really negative perception of your own body that for me and a lot of other people developed into an eating disorder.
Right.
And I know my friend here also wanted to touch on eating disorders during the pandemic.
I personally definitely struggled with this, and a lot of people I know struggled with this as well. You get so used to just laying there in your bed all day that you don't have the motivation to get up and make yourself a snack because it just feels like too much work. And I think that could be also linked to the depression. But when you are not able to just go out and, I don't know, stop by Chick-fil-A and get a chicken sandwich, like, we were so used to being able to just go out and spend $10 and have a meal made for us that we didn't have the skills to make our own food, and that just led to us not wanting to eat because it was a lot of effort. And again, seeing the idealized bodies online, it made you think that, like, maybe if I skip this meal, I'll be able to look like her or him.
I want to thank you both for sharing your stories with us today, and I want to come back over to you, Dr. Usher, about managing that, dealing with that, coping with that.
First, I appreciate your bravery in talking about this, and I think this is something I've heard echoed in my office and in my practice from so many young people. It seems to me that, of course, there are many paths to developing problematic eating and eating disorders. One of those paths is often that people use food as a means of control. It's the one thing that I can control, what I put in my body and what I don't. And for 2.5 years, I think a lot of young people, a lot of adults felt out of control. They weren't in control of when they could go back to work, when they could go back to school, who they could see, how they could see them. And so that became a means of control. I think one of the challenges is looking at images. We could no longer celebrate. We ask people to celebrate what your body can do for you, not how your body looks. Celebrate your body because it can do things. But when you couldn't do those things, it was very difficult. Well, I think the onus is now on us as a society to make sure that we provide as many opportunities for people to do things with their bodies, to go running, to go to, go up to Forest Park, Mount Tabor, get out in your community, literally be grounded with 2 feet on the ground with another person and enjoy nature. We live in a beautiful place. It takes a rain jacket, especially this season. but we need a commitment to be together and to start doing things together. So that would be one solution.
We're going to talk about barriers to treatment. Much more to talk about in the next 15 minutes. We'll be back with our town hall after this. Welcome back to our Youth Mental Health Town Hall, and we are talking barriers to treatment, and there are many of them. In fact, one of them, many folks feel that there's still a stigma associated with mental health now, and that's causing some folks not to seek the treatment. I want to bring in Angie Welty, and if you've seen past town halls, you've seen Angie on our program. Her son Cody is a suicide survivor. We're so glad you're with us today, Cody. Thanks for coming on the program. Angie, you wrote a book called Mayday, which I was reading earlier. And you talked about the fact that there's still a stigma associated with mental health these days.
There is. I think that we've come a long way. You know, for us, we're going to be celebrating a 10-year anniversary from Cody's suicide attempt. And when that happened, there was no communication. So you young people have definitely brought it forward. But there's still a stigma surrounding it. I don't know that everybody can still feel that they can talk about it on a day-to-day basis. It's just normal table talk conversation. And also be able to talk to whoever it is that you're interacting with. It's not just your loved ones, but the people that you're around every day at work, the barista at the coffee shop that you may think is not having a great day. Do you feel like you can have those conversations? Hey, are you doing okay? Are you doing all right? So I still think that we need to continue to educate everybody on the fact of it's important to make connections. And when you guys talk about connections and the fact that that isn't what you've had, I can't imagine what that was like for you during those times to not have connection, because that's imperative. And that's what leads to also more stigma being broken down, because you're going to talk and you're going to expose yourself and you're going to have your peers to communicate with, or your teachers. You talked about that. All those people are imperative in your life to continue to break down the stigma. And that's what we're here for.
Important information from someone who's been there. And again, thank you for coming. And I know this gentleman was waving his hand that he wanted to talk about this. Go ahead. What do you think?
Yeah, I think there's definitely a stigma against like getting therapy and stuff, and I think we need to normalize that it's okay to not be okay. You know, there's everybody like deals with problems, and I like to touch on therapy and that it's gotten somewhat difficult in recent years on getting therapy for some people that I know, and just like having the courage to actually get therapy, that's a problem in itself. But also just like booking one, the wait times have been crazy that I've heard of like up to 3 months. And then when you actually get to the therapist, you don't know if it's the right fit for you because it's all about building relationship. And sometimes that therapist might not work for you. And sometimes they might only be able to meet virtually. And that might not work for everybody. So it's just like a super long process to even get into therapy that I think needs to be more efficient.
And is that going to change, Dr. Franz?
Well, I think it is changing. As I mentioned earlier, you know, we are able to add more brick and mortar providers, working hard on developing a workforce. You know, Ebony's doing that at the Oregon Health Authority. How can we incentivize young people to go into behavioral health because we need so many more professionals? There is this movement I've talked about of probably because of COVID, a lot of behavioral professionals started to like to work from home and work remotely and work virtually, and that's just the reality. And because of that, some organizations have now become more virtual first. And if that's where the supply is, I think it is where sometimes we need to go to try to access resources. You're absolutely right. It does not work for everybody. So we have to have that brick and mortar option as well when folks want to be seen in person. But you'd be really surprised. I'm trying to get the word out that there are resources now. There are organizations that offer virtual treatment, intensive treatment for eating disorders in the home, where you could call if, you know, you have to have insurance. It's another barrier. But if you're covered, you call today, you're going to get seen within days, not weeks, not months, days. There's organizations where you can get seen by a psychiatrist within 48 hours. It's very hard to do that here in the community. You're going to call a lot of people. You're not going to get in. So the world's shifting a little bit as to where you can get behavioral health resources, and we just need to make sure that we make it available.
Before we move on real quick, Deb, I just wanted, what you just heard, does that help you at all?
Yeah, I would totally agree that there's like through my mom's job, like that's how I got my therapy, and there's a ton of organizations to get virtual therapy.
All right, thank you for speaking up. Appreciate that.
I want to talk to Marcia Hilly now and talking about the barriers. Are the universities set up, structured in order to bring in more resources as we look to the future?
Well, one of the things that has been a result of the pandemic is the new light that's been shed on the needs for mental health services. The state has been proactive in funding schools to develop new programs, expand programs that I think is going to be helpful down the road. Hopefully in this group we have some budding clinicians that will be working in the field soon to help with our workforce shortage.
All right, Sarah, I know that you work with Youthline. What kind of experience are you seeing?
Yeah, so at the crisis line over the course of the pandemic, we definitely have been seeing issues that have been pre-existing worsen as people are isolated, having to stay at home. I think another issue that I've been witnessing within, not just with Youthline, but throughout my time working in the behavioral health workforce, which has been about 4 years now, I've noticed a lot of burnout from coworkers in my own life and my own career, and it's difficult to watch as someone with lived experience who remembers a time where I very much needed mental health care and still do. I'm still in therapy, and knowing that there's a need for it, and also knowing that Oregon systemically has had one of the worst access to care nationwide, and we also have the highest prevalence of mental illness, and suicide has been a big issue among our youth for quite some time now, and that only was exacerbated by the pandemic. And it's challenging because we see in our communities that there's such a need for these things. And also on the other hand, we have barriers to getting young folks involved in choosing a career in behavioral health, largely the fact that it's very easy to get burnt out, especially with the pandemic. Working in behavioral health the whole time, there were instances where I had to leave the room and cry. My supervisors had to leave the room and cry because of
situations that were just very intense. And it's awesome getting to do work that you know makes a difference in the community, and that's very needed, but also vicarious trauma is very real. And it's also difficult because it's, I think Oregon is still working on creating a behavioral health system which properly compensates its workers, not just for the work that they're doing, not just for their professional experience and their professional skill, but also for the aftermath of it, for proper compensation and proper support for folks who are doing that groundwork.
Thank you, sir.
Ebony, we have about 90 seconds before we have to take another break, but I saw you nodding your head there when she was talking, and you certainly see the frustrations and the barriers that people have to overcome to get this treatment that this gentleman was talking about. Give me your perspective on that.
Yeah, well, I'll just say that, you know, what we find in terms of the workforce, 1 out of every 3 positions are vacant. And so when we couple the issues specific to the Great Resignation, folks going into retirement, decreased interest, you know, of folks wanting to come into the field because the jobs are not competitive, because of the acuity of the issues and challenges, it makes for a perfect storm. But what the state has done is the state in this biennium has invested millions of dollars into the workforce to keep agencies whole, to help incentivize for paying for scholarships so that we can get a new bolstering workforce, to pay for the licensure and certification requirements so that folks don't have to pay out of pocket, because a lot of times we find that clinicians are also living paycheck to paycheck, and that's unacceptable. And so at OHA, we've been really committed to doing all that we can to really bolster the continuum.
Ebony, thank you.
Thank you.
This is an important conversation. We'll continue when we come back.
Welcome back to our Town Hall Youth and Mental Health. And I'll tell you, we've had a lot of town halls over the years, Deb, and this is one of the most important ones we'll ever have. Discussion so incredibly important. So great to have all of you here today. Could not do this without your voices. We need to hear you, and the experts need to hear you, and all the folks at home need to hear you as well. Dr. Franz, before I go, I want to get a last word from you, about 20 seconds.
Sure. I'm just so honored and impressed by the young people that we have here today. They're the ones that are informing the discussion. They're the ones that have a lot of the answers. As leaders, we need to hear what they're saying, put it into action, because they're the future, and I'm feeling pretty good about it right now.
I know it. These folks have been through it. There's no question about it. I think there's some hope on the other side of this. You know, when I was looking through the notes with all these kids that we talked to earlier, one of them said, you never know what someone's going through, so just be nice.
Isn't that important?
And I think that's the key. So
Great
give
advice.
yourselves a round of applause, would you guys? You guys did a great job today. We appreciate it very much.
If you or one of your loved ones struggling out there, there's help available. We have a list of resources on our website. Either head to katu.com or scan the QR code on your screen. The code will take you directly to our page with numbers and information on where to find help.
Thank you for watching, folks. Good night.
The previous special program was sponsored by Regence Blue Cross Blue Shield of Oregon and Sequoia Mental Health Services.